Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals, and welcome to this week's update, which focuses on our partners. Today we hear from Russ Piper, Chief Executive of Bradford-based Sovereign Health Care. The company started as one of many hospital funds which existed during the Victorian era, a long time before the NHS, as a way of helping people to access healthcare. Russ tells us about how Sovereign continues to support the NHS through their community programme. And we hear also from Sharon Milner, Charity Director for Bradford Hospitals Charity, about the wonderful contributions that they have made to our work here at the Trust.
We were formed primarily to raise funds for the hospitals in Bradford, initially in 1873 as the Bradford and District Hospital Fund. And by the 1930s, we were producing about 40% of the income required for Bradford Royal Infirmary. The association with the NHS is really special for us because one of the key things that we try to do is to make sure that we put people first on principle, that we look to do the best we can for our customers when accessing everyday healthcare. We provide a type of general insurance which helps people access everyday healthcare, and we help towards the cost of that.
It's fantastic to be linked to Sovereign Health Care and to have that relationship. It's just phenomenal, their support, and really rare. They've done it in such an amazing way, and the impact on everybody has been phenomenal.
We aim to gift between 5 and 10% of our annual turnover, not our profit, our annual turnover each year, to health and wellbeing good causes. Bradford Teaching Hospitals has been a special partner for us, and we've made some significant donations, and we've been delighted to do so.
We've seen donations towards staff nursing courses, again, massive impact on those individuals. The Sovereign Lecture Theatre, I mean, it's amazing, not many hospitals have that, but we have it here, and it's thanks to Sovereign. Great examples of how Sovereign have helped in most recent times have been the Vinci Robot.
Back in 2012, when BRI got its first Vinci Robot, that was a game changer in terms of treating patients who required prostatectomies. All these years later, the second Vinci Robot's in place, and once again, we're really delighted to be involved in that as well.
You can now use very small incisions, which means less scarring, less pain. Old-fashioned colorectal surgery required 2 weeks to recover from a procedure. With advanced keyhole surgery in the form of robotic surgery, we are seeing discharges from hospital as early as 2 to 3 days after the procedure.
If the staff are in control of what they're doing with a robot or new equipment, that just impacts, yes, on the patient, of course it does, but the staff themselves in their day-to-day job. I don't think people realise the impact it has to the whole service.
At St Luke's, we supported the dialysis unit, which obviously gives patients with kidney problems much better quality of life. We've always been involved in things like Team of the Year, the Hospital Oscars, and seen some of the fantastic things that go on in Bradford. I'm like a stuck record saying, why isn't somebody on the roof shouting out the positive things that happen in Bradford? Because there are so many of them.
I'd like to say thank you, what the difference they've made to all the teams here, not just one single team in one single department, but across the hospital. We cannot do things that we do without organisations like you.
What we've witnessed, especially since the pandemic, is a big change in society, and I think it's important that healthcare changes with the times and partners with hospitals, with trusts, doing the right thing for our customers, doing the right thing for the community. We're a Bradford-based business. We've been in Bradford since 1873. It's right that we support the Bradford community.